My name is Shirok Kapadia. So I do some consulting work for Topcon and for Johnson & Johnson Vision Care. I practice in Jacksonville, Florida. And just some brief background information. I graduated back in 1998 from the Michigan College of Optometry. I did a residency at the Bascom Palmer Eye Institute for a year. In 2003, we opened one of these practices cold. And in 2012, we opened this practice cold. The bigger practice has 4 lanes. The smaller practice has 2 lanes. And we have about 30 full-time employees. There's 5 doctors at the practice. And you know, one of the things that we've instituted at our practice from the very beginning is back in 2005, we purchased a Topcon digital fundus camera, and we've been incorporating a screening type of retinal evaluation since 2005. And in 2009, I purchased a Cirrus 4000. So we incorporated an OCT optic disc cube and Mac cube scan at that time. And in 2012, we upgraded to one of the bigger Optoses. And then most recently, about 3 years ago, we purchased a Daytona from Optos. So our current protocol when we're taking care of our patients is for our patients at any age, we start doing a screening optomap with a Daytona. And if they're patients that are 40 years or older, for routine eye exams, we do a OCT optic disc cube and an OCT Mac cube. So we're on track to do about 8,000 comprehensive eye exams in 2018. So just to kind of walk you through, this is the larger practice over here, and the waiting room is off to this side here. Patients come in and we do a Daytona imaging, and that's the Maestro that we've had at the clinic for the last about 2-3 months. Ben helped set it up at the practice. So the patient sits down and they have the optomap done there. They go next door, and we have now a Cirrus 5000. So they have their OCT optic disc cube and Mac cube scan done, 2 separate scans. And then we have 4 exam lanes at this one location. So when we come into the room as the physicians, you know, the patients are sitting off to the side right here. And it just allows us to, on this screen here, we have the EHR data typically, and then that screen here is mirrored to this TV monitor here, and the patient's sitting here. So we can properly discuss any, you know, pathologies or findings. Most of the time when we're doing our routine eye exams, typically they're pretty healthy. But they're interested in knowing what those tests were done for, and it's a nice way to show them their clinical findings. So that's the typical setup in all 6 of our exam rooms that we have. So from my perspective, using these instruments since 2005, I like to be able to come into the room even if it's for a routine eye exam, and I like all that information in front of me. I like to be able to take a look at their retina. I like to be able to take a look at their OCT optic disc cube, Mac cube. And I don't go into a great deal of explanation with the patient, but it's still a nice way to have all that information even before I start the refraction, because we do our own refractions, the optometrists. The patients are worked up by our technicians. From my perspective, it's been really nice because when they come back for their eye exam in their 2nd, 3rd, 4th year, we don't necessarily need to dilate them at each visit. So it's a lot easier flow. We don't have to work them back into the exam lanes after each dilation. From the patient's perspective, there's an immediate wow factor for them because we have these instruments in our clinics, but a lot of times we're not utilizing them as much as we should be because we're just using them for actual medical billing purposes. But for them, they've not seen these instruments before. They've not had this testing done before. So, you know, often they notice the innovation in the technology at the practice that they've not had at other optometry practices. And this is just for their routine eye exams. And for St. John's Eye Associates perspective, it's just kind of our brand to practice with this innovation and technology. And also there is a financial aspect of it going back to those, you know, 8,000 patients that we're going to see in 2018. So the financial reimbursement for the screening tests is a big benefit for both practices. Uh, you know, I think a lot of patients don't really even want to come see us in the first place, and if they do come to our offices, they don't want to spend any more than an hour at our locations. And you know, one of the things that we're really mindful of is trying to be respectful of their time when they come in. Like at 9 o'clock, we want them taken straight back for the pre-testing. The technician usually spends about 15 minutes with them. I come into the room at about 9:15. I have 15 minutes of time with my scribe to take care of my patients. And then my goal is to get them onto that optical floor in a half hour. Because if we go beyond, you know, 43 or 44 minutes, the sales in the optical start to kind of precipitously decline. So it's really important that they're out there at about 9:30. That way they can spend that time with our opticians, have a good experience there. And we all live our lives in these 1 hour increments. So we want our patients to feel comfortable, but we want to respect their time. And those periods of time when we go over an hour, you know, there's some negative consequences in terms of social media reviews. A lot of patients may not complain, but unfortunately they might not come back because they don't want to be at the practice, you know, for any longer than an hour. So, I mean, just for you guys, how long do you guys usually keep your patients at the practice for a comprehensive eye exam? Is it hour, more, less? Okay, so I've been working with Topcon since about 2011, and they were familiar with my protocol in terms of using the Daytona and the Cirrus for routine screening. And they said, you know, Shirok, you know, we have this new OCT instrument called the Maestro, and would you be interested in bringing it into the practice and seeing if it would be a benefit for your practice, for you, and for your patients in terms of a time savings possibility. So the goal of the study was they wanted to do a comparison with the Maestro using the 12 millimeter by 9 millimeter with the full spectrum fundus photo versus the Optos Daytona fundus in combination with the Cirrus 5000, where we're doing the 6 millimeter by 6 millimeter scan of the optic nerve head and the macula. And I was kind of intrigued that, you know, could this be a benefit for our practice, for our patients, for the doctors? So, you know, I agreed, and Ben graciously helped install the instrument back, I think, in August. And that's the Maestro OCT, real nice small footprint. And the actual CTMOZ study, what it involved is just following the protocol that we use at St. John's Eye Associates. It was involving 50 new patients to our practice, 40 years or older, with no known retinal or optic nerve head pathologies. And we enrolled them, and we wanted to do a comparison of the time from the initial data entry for the Maestro, for the Daytona, and for the Cirrus to the end of the examination between the two examination protocols to see if there would be a time difference between using those instruments. And we also wanted to then do a comparison of the incidences of pathologies discovered using the Maestro versus the traditional Cirrus and Daytona that we were using. So, you know, I was kind of skeptical. I thought maybe we'd save like a half a minute, maybe a minute, no more than that. So I was pleasantly surprised when I reviewed the times over the last few weeks and kind of came up with an average that we were saving 3 minutes per patient. And, you know, typically if one of our physicians is seeing 20 patients a day, and assuming that they're over the age of 40 or 40 and above, that's a 60 minutes of time savings for that one physician's patients. So the patients are saving that time, as well as the technicians are saving that time. At both locations, we usually see patients about 300 days a year. So if you kind of annualize that, that's a significant amount of time saved. And it's actually beneficial for us because the physicians can get to the patients at that 15-minute mark and get them out onto the optical floor at that half-hour mark. So a big savings in time. So another benefit, we were early adapters to the Cirrus OCT, purchasing our first instrument in 2009. And we're still using the the 400, or actually the 4,000 at our smaller location, and we're using the 5,000 at the bigger location. And we've had employees over the last 9 years, and just in terms of the learning curve using that instrument versus the Maestro, Ben set up the instrument in August, and my technician team, they were trained in an hour. So, just the buy-in for them, the ease of use of the instrument, the ease of use of programming the instrument and actually taking the images. I mean, there was a tremendous amount of buy-in from my technicians. And I really liked, I was just kind of observing. We have 3 pre-test rooms. It was really nice not to have to go into that room that had the Cirrus OCT. We could bypass that room. So that was a nice time savings for the patient. And in the actual exam room, when all the images are loaded up, so I've been traditionally, I've never like printed up the PDFs and looked at the software that way. We have the review software in all 6 of our exam lanes, and at the doctor's stations we have the review software. That way, if we're talking to our patients, we're actually going through the review software, not just a PDF image. But it's really nice just to have that one program brought up versus having the 2 programs brought up. So from the doctor's point of view, I think there's more ease in using the review software. And I like the fact that with the Maestro, if someone does have any retinal pathology, you can pinpoint the retinal pathology using that fundus image, which I like the detail of that fundus image, and then also kind of correlate it with the OCT scan. So it's easier to do that. I do that currently with the Daytona and the Cirrus, but it's 2 different instruments that I'm using, 2 different review softwares. And I like the fact that when we incorporate this Maestro in, that it's going to improve our patient flow. It's going to spend, they're going to be spending less time actually in the clinic. And I kind of like that we're going to continue our, that model of screening patients that we've been currently been using. So, big time savings. And then for those of you that have the instruments and, kind of looking for an additional source of revenue, I mean, patients are really wowed with the screening aspect of the, the retinal imaging as well as the OCT. So I appreciate your time. If you guys have any questions, be happy to answer them.